In this video, we will explore colonic polyps, abnormal growths that can occur in the large intestine. We will discuss their types, causes, and how to manage them effectively. Let's delve into this important topic together. Colonic polyps are growths in the large intestine that can be neoplastic or non-neoplastic. Neoplastic polyps have a higher risk of turning malignant, making their identification and removal crucial for preventing colorectal cancer. The development of colonic polyps involves a complex combination of genetic and environmental factors. Genetic mutations in tumor suppressor genes and oncogenes contribute to the initiation and progression of neoplastic polyps, while environmental factors like diet, smoking, obesity, and a sedentary lifestyle also play a role. Hereditary polyp syndromes like FAP and HNPCC are known to be influenced by genetic factors. Colonic polyps can be classified based on their histological characteristics, location within the large intestine, or their malignant potential. Examples include adenomatous, serrated, and mixed polyps, as well as distinguishing between proximal and distal polyps. Another approach is to assess the malignant potential, categorizing polyps as benign, premalignant, or malignant. Hyperplastic polyps represent the most common non-neoplastic colonic polyps, accounting for approximately 80% of all hyperplastic lesions. These polyps are characterized by a hyperproliferative epithelium and often exhibit a smooth, sessile appearance with a crypt architecture that is mostly retained. While most hyperplastic polyps are benign and do not progress to malignancy, certain subsets, particularly those associated with the serrated pathway, have an increased risk of developing serrated pathway adenocarcinoma. Differentiating between these subtypes of hyperplastic polyps is important for appropriate management and surveillance. Adenomatous polyps are the most common neoplastic colonic polyps. These polyps arise from dysplastic epithelial cells and can progress through a series of histologic changes leading to colonic adenocarcinoma. Adenomatous polyps can be further classified into three subtypes: tubular adenomas, which have a tubular glandular architecture, villous adenomas, characterized by elongated finger-like projections, and tubulovillous adenomas, exhibiting a combination of both tubular and villous architecture. The risk of malignant transformation correlates with the subtype and size of adenomatous polyps, emphasizing the importance of timely identification and removal. Familial adenomatous polyposis is an autosomal dominant inherited disorder caused by germline mutations in the adenomatous polyposis coli, APC, gene. Individuals with FAP develop numerous adenomatous polyps throughout the colon and rectum, often starting in adolescence. If left untreated, these adenomatous polyps inevitably progress to colorectal cancer. The management of FAP involves a multidisciplinary approach, including regular surveillance, endoscopic polypectomy, and, in severe cases, prophylactic colectomy. Hereditary non-polyposis colorectal cancer, also known as Lynch syndrome, is an autosomal dominant disorder characterized by mutations in mismatch repair genes, such as MLH1, MSH2, MSH6, and PMS2. HNPCC is associated with an increased risk of colorectal cancer and other malignancies. Surveillance strategies for individuals with HNPCC involve regular colonoscopies, molecular testing, and risk-reducing strategies, such as prophylactic surgery. Sessile serrated adenomas represent a distinct subgroup of colonic polyps that are associated with an increased risk of colorectal cancer development. SSAs exhibit microscopic features, such as abundant crypts, horizontally arranged crypt bases, and serrated architecture. These polyps are often challenging to detect during colonoscopy due to their flat or sessile appearance. The diagnosis and surveillance of SSAs involve meticulous endoscopic examination, chromoendoscopy, and close monitoring due to their malignant potential. Juvenile polyposis syndrome is a rare genetic disorder characterized by the presence of multiple juvenile polyps throughout the gastrointestinal tract, including the colon. These hamartomatous polyps have a distinct histology and can lead to potential complications, such as gastrointestinal bleeding, intussusception, and the development of colorectal cancer. The management of JPS involves regular endoscopic surveillance, polypectomy, and, in severe cases, surgical resection. The management of colonic polyps requires a tailored approach depending on various factors, such as the size, number, histological subtype, and patient-related factors. Surveillance intervals are determined based on the characteristics of the polyps and individual risk factors. Endoscopic resection techniques, such as snare polypectomy and endoscopic mucosal resection, are the primary methods for removing polyps. In certain cases, surgical intervention may be necessary, either due to the presence of large polyps or as a preventive measure in high-risk individuals. The natural progression from benign colonic polyps to invasive colorectal cancer is a well-established process known as the polyp to cancer sequence. Understanding this sequence helps emphasize the significance of early detection and intervention through screening programs. Regular colorectal cancer screening, such as colonoscopy, sigmoidoscopy, or fecal occult blood testing, aims to identify and remove precancerous polyps before they progress to malignancy. Chemoprevention refers to the use of pharmacological agents to prevent or delay the development of colonic polyps and subsequent colorectal cancer. Nonsteroidal anti-inflammatory drugs, NSAIDs, and aspirin have shown promising results in reducing the recurrence of adenomatous polyps. These agents exert their effects through various mechanisms, including inhibition of prostaglandin synthesis and modulation of apoptosis and cell proliferation. The use of chemopreventive agents is an evolving strategy for individuals at high risk of colonic polyps and warrants further research. In conclusion, studying colonic polyps has taught us about their types, causes, classification, and treatment. Detecting and removing polyps is crucial in preventing colorectal cancer. As doctors, it's important to stay updated on the latest developments for better patient care.